My name is Jody Jollimore, and I am the Director of Research and Strategic Partnerships at the Health Initiative for Men. I'm also doing some research and consulting work as well. Today's topic is PrEP, and I see some familiar faces in the room. I think we have a fairly literate group here, so I think I'd like us to start off in a place where we recognize that PrEP is a good thing from an HIV prevention standpoint, from an empowerment standpoint for women and men to be able to empower themselves to engage in HIV prevention in a different way, from a personal pleasure perspective. But we also know that from the outset, PrEP has been controversial. It's been value-driven, sometimes morally charged arguments. I've seen some at this very summit, actually. And this is understandable because PrEP challenges us as a community. It challenges a community norm that we've held for a long time. It's opened up the door for us to have a conversation that hopefully is an honest conversation about condomless sex. And for some of us, that was forbidden or taboo for so long that it seems only fitting that when we're having these conversations, there's going to be some heated and charged discourse. Today, though, because we're trying to keep with the theme of the summit, we're going to talk really briefly about access, but what I really want us to get into is the stigma. And when I'm talking about the stigma, I don't just mean stigma for outsiders looking at us as gay guys or from outsiders looking at us as sexual beings, but stigma that we may have in this room, that we may feel about certain things. Certainly, one of the things that I experienced, so I'm a PrEP user. I've been on PrEP for about a year, and in the beginning, I remember coming out to a healthcare provider, a gay man, who I would have thought would have been quite supportive about this. And his reaction to me was, and it was like a visceral sort of, he got angry, and his response was, well, Jody, I haven't given up on condoms. I'm disappointed that you have. And that wasn't really the case for me. I hadn't given up on condoms, but I had found another option that I felt provided me with some more flexibility. But what it did do was force me into the closet in some ways about my PrEP use. I talk about it personally, and I talk about it in our team meetings at HIM, but for a long time, I didn't really discuss it in public forums because I felt that there was, that I felt stigmatized by that. And then an internal stigma that I guess, place on myself, and I think that's kind of the angles that I want us to think about today, is not just how we stigmatize others, but perhaps some of our own self-imposed stigma. Sometimes I find when I'm talking to pause guys, I feel guilty about talking about being on PrEP, because I feel like either they didn't have the opportunity to take that, or perhaps they seroconverted many years before it happened, and so it's almost a survivor's guilt that I feel sometimes around that. And so it's something that I've had to confront as well. And I actually want to be clear. The pause guys I know are completely supportive of PrEP, and none of them in any way, shape, or form hold that against me. But at the same time, I do feel a bit of a guilt around that. So those are just some of the things. I wanted to bring a little bit of a personal perspective to it because I think that's what we want to talk about today. But we do have 3 frontline healthcare providers here who I'm very excited to introduce. And so today's session, while I am a PrEP user, I'm also a frontline, I work in gay men's health, and that's really the perspective that we're bringing, is for people who are either working with people who are currently on PrEP, or we're working to increase access to PrEP. So you have us as much as we have you, so I'm hoping that we'll do a bit of brief presentation, but I'd really like to have a conversation with this audience about some of these complex issues. So with that in mind, I would like to start with Maxime, and I'm going to read you Maxime's bio. Maxime Blanchette has completed a BSc in psychopsychology from the Université de Montréal and is currently completing his BSW there in social work. His interests surround the themes of homosexuality, immigration, and mental health. Maxime works for the CHUM, the Centre Hospitalier de l'Université de Montréal, as a counselor within the Gay study, which validated the effectiveness of on-demand PrEP, where he does counseling, offers support, and does sexual health consultations with participants. He has also established new contacts and tools to facilitate the recruitment of participants. Furthermore, he's also a part of the team at Réseau, a Montreal-based community organization, where he currently focuses on knowledge transfer of PrEP intervention. Maxime, would you come give us a brief introduction on PrEP and also introduce us to some of the themes that you're experiencing in your work?
Of course. So, hello everybody. So, like Jody introduced me, we're going to talk about the stigma around PrEP. So it's been 2 years now that I work at Réseau / the CHUM, so the hospital, counseling with the guys taking PrEP on demand. So today, basically what we're going to talk about, we already did the intro. I'm going to introduce you to PrEP, just so we are on the same page. Then we're going to talk about all the ethics surrounding PrEP, the stigma, of course, we're there for that, and what the non-users of PrEP are thinking about the users, and vice versa, the experiences of the hypergay participants, and we're going to talk and compare to with British Columbia, with Marcus' experience too, and Mr. Marc too. And after, we're going to try to talk about all the coverage around PrEP in the media and how it stigmatizes more the gays in the community. So I think this part is done already. So what is a prophylaxis? So PrEP stands for pre-exposure prophylaxis. A prophylaxis is a prevention strategy that aims to prevent catching a disease. For example, the protective layer dentist puts to prevent cavities is considered as a prophylaxis. So if we take back the word pre-exposure prophylaxis, it means that it prevents something beforehand. The opposite, the PEP, post-exposure prophylaxis, it protects you after you've been exposed to something. So, PrEP, pre-exposure prophylaxis, or PrEP is a way for an HIV-negative person who is at risk of HIV infection to reduce their risk of becoming infected with HIV. It involves taking anti-HIV drugs on a regular basis. So, there's different type of PrEPs. Now we're going to talk about the PrEP for HIV, and there's 2 ways to take in it, we can say. There's the daily PrEP, so we take the PrEP every day. There's no more explanation than that. You need to take it every day at the same time. And there's on-demand PrEP, so that means that this is around the sexual encounter. PrEP is a new risk reduction strategy that prevents HIV, and many studies have studied PrEP. And the results of the 2 last studies, which are PROUD and hypergay, where I work, mentioned that Truvada has an effectiveness of 86%. So it lowered the risk quite a bit, actually. So this is an overview of all the studies, and I'm going to need water. As you can see, there are many other studies that have taken place beforehand, as like the Capricot in Africa and other. What we have to keep in mind is that we tried to study the vaginal gels, and right now we're working with all the pills. That works. Sorry. With pills. Yeah, and right now there's other researchers that are working on long-lasting injection. So that means that people that have like poor adherence would be good for them. It would be good for them because that way they, sorry, I was looking at him. So that way they only have to go back only once a month or every 3 months, and it's easier to adhere to the treatment and being on point. So the PrEP on demand versus daily, like I said earlier, on demand, the person needs to take 2 pills at least 2 hours to 24 hours beforehand, before the sexual encounter. And after the sexual encounter, the person needs to take the pill like for 48 hours every 24 hours. So 1 pill a day every 24 hours for 48 hours. 48, yeah, 2 days. Some people may think that PrEP on demand is more risky than taking it on a daily usage. But with the hypergay study, it shows that taking 2 Truvada pills at least 2 hours before the exposure is enough time to have the med working and have sufficient level of Truvada in the rectal tissues. And yeah, I'm saying that because some people are saying that you need to take PrEP like a week before to have enough meds in your rectal tissues. But with that study, it shows that even with 2 hours prior to the encounter, it's all right. Which one do you think would be better? Daily or in demand? Okay. Both. It depends on what you have, like sexual patterns. Let's say you have sex every day, a daily usage would be better. If you go to saunas, let's say saunas, every 2 weeks, then why taking PrEP every day when you have sex only once every 2 weeks? You know, you're taking meds for nothing, between parentheses.
I think this question.
Yeah, go ahead.
I have a question. I could only answer that question if I was negative. If you're taking daily, what's the risk of long-term use of the Truvada? And is that why they're recommending or allowing patients to have it on demand?
I'm sorry, I didn't quite understand what you were saying.
Truvada over daily use over the long term, say 20, 30, 40 years, is there hazards with that? And is that why it's being offered
On demand? Okay. I think they want to offer on demand because of the sexual patterns, and yes, it has a certain toxicity like any meds that you're taking. So, but until now, and correct me, Mark, if I do a mistake, there's nothing that shows that it could be harmful. There are some people that are more, let's say, sensitive about the meds, but it's a small percentage. It's like 1% of the people that could have liver problems or kidney problems, things like that. So it's really, really low. And that med is a pill that HIV positive people are taking too, and they don't have that many like bad side effects, you know, physical side effects. So does it answer your question?
Yeah, pretty much. I imagine they picked Truvada because it has the least side effects.
There you go.
So, but I don't know that. Just curious.
No, it's all right. It's a good question. So I already talked about that. So how do we get PrEP in Quebec? Okay. This is the tricky part because we're going to be comparing British Columbia to Quebec. It seems that it's really different in Quebec versus the rest of Canada. I don't know why. So
It's not just the PrEP.
yeah. So how does it work? So first, the person needs to want PrEP, you know? So let's say I want to have PrEP, so I'll go and get an appointment with my doctor. You can go and see your family doctor. You can go and see a specialized doctor. We have a few clinics, specialized clinics in Montreal, and there's one of the clinic that made or created like a specific clinic for PrEP prescription. So people are getting there to see the doctor, the nurse, do the blood test, things like that for having PrEP prescribed, which is pretty good, and it helps against the stigma too. So yes, you go see the doctor, and the doctor evaluates the risk you're taking. Let's say that you use a condom every time, you might have lowered your chances to have PrEP prescribed because you're not taking enough risk to get it. I'll go back on all the criteria that the doctors have a bit later on, but we need to keep in mind that. Oh, I need to speak in that? I don't like it. Sorry. So.
Get good with it.
I'm going to shut my mouth on that. Yeah, what I was saying, that, yeah, you need to take risk in order to have PrEP prescribed. So we have to keep in mind during the presentation that it's a certain way to stigmatize and to label the people that are taking PrEP. So we're stigmatizing people from the beginning with the prescription, basically. But we're going to talk about that later. So after, there are some blood tests, like I said, to make sure that you're physically healthy and that you can take the PrEP because it has a certain toxicity. Then PrEP is prescribed. And now the tricky part where the payments goes. So in Quebec, we have the Medicare. I don't know for the rest of Canada. Do you have like public Medicare? No, okay. We have a public Medicare.
Public Medicare, but not pharmacare. That's what
Oh,
we're talking
okay. Okay, pharmacare.
Okay, sure. Yes, we do. That's true. There's a pharmacare program. They don't cover PrEP, that's the point. They
Oh,
don't cover
okay.
Truvada. They do in Quebec. That's really the difference that
Oh,
we're
okay.
trying to underscore here.
So here in Quebec, there in Quebec, PrEP can be covered by the RAMQ, the Medicare. So that means that the price of PrEP for a month turns around $89 to have the prescription. To make a comparison, PrEP without any like insurances costs around $1,200 a month. So it's quite a bunch of money. And then you have the private health insurances, so you need to talk to them to know how much they're covering, because some are covering for like 50% of the prescription, other 80%, so it depends on what are their criteria, basically. And then there's the iPrEP study too, where I work. We're not taking any participants anymore, but at the beginning we were enrolling people, and they were given PrEP. So that was a free way to have PrEP. At the beginning, we had a placebo, so it was a bit controversial. But right now, oh, sorry. So right now, everybody is on PrEP, or you can pay 100% of the prescription. So ethics surrounding PrEP. So as you can see, there are many points that could be seen negatively. But if we take them one by one, we can like disarm them. Oh, I need to speak of that. That's true. People may think that taking PrEP would result in riskier sexual behavior. So, do you think it's true? No? From my experience, what I can see is that people, they were either already taking risk anyway. So if you're not using a condom, do you really think that you're going to use it more? PrEP is a prevention strategy. It's something more, you know, to give people choices, new choices, actually. Yeah, and the question we have to ask ourselves is, were you taking these risks before having PrEP or not? Then, PrEP doesn't protects against other STIs. On a public health perspective, it could encourage ignorance of other STIs. That might be true, but PrEP is kind of a regimen. I mean by regimen is that when you go and see a doctor, you have your PrEP prescribed, but you need to go see him every 3 months in order to have your PrEP prescribed again, and you need to pass some blood tests every 3 months, and you need to talk to a counselor about your sexual behaviors and see if you can apply other sexual risk reduction strategies in a sexual context. PrEP encourages bareback sex. What do you think about that? Yes. How so?
Yeah, I think just suddenly having another choice. You don't have to use a condom. If
Mm-hmm.
you're not as concerned about other STIs, it will encourage more bareback sex.
Yeah.
I think that's the point.
To have bareback sex with a PrEP? I see PrEP as another prevention strategy. So some people don't like or can't use condoms. So in that sense, that makes sense that they use PrEP. But at the same time, I think taking PrEP is taking care of his health, you know, his sexual health. And other people will take PrEP as an insurance, like a protective layer. Let's say you're going in a bar, usually you use condom, but that time you were too drunk and you, oops, I slipped, I didn't use a condom. Oh, then you have PrEP. You were on PrEP. So it's like a safety net, let's say. Other people might say that giving expensive ARVs to HIV-negative people, when some people in the world do not have access to ARVs, could be an ethical problem. Yes, it could be, but at the same time, is it a reason to not prescribe PrEP? Now, it raises like ethical issues about social justice, healthcare inequity. So why blaming that on people that want to take care of their sexual health and try to, you know, to work more upstage, to work more from an upper level, like the government, the politics, things like that. Stigma. So like I said before, we're going to talk about the non-user point of view, the users, and all the experiences that we can hear in our own jobs. But first, I want to define what a stigma is. I retained that definition because I liked it. So, characteristic of a person that is contrary to a norm of a social unit, where a norm is defined as a shared belief that a person ought to behave in a certain way at a certain time. So basically being stigmatized is being labeled, and it's not being part of the norm. But here, in the context of gay sexuality, what's the norm? What is the sexual norm? Anything, any idea? I think, do you have any idea?
Well, I think that from an HIV prevention lens that we're told to wear condoms when we're having casual sex with partners whose status we don't know.
Mm-hmm. Yeah. And I think that to understand the sexuality, the normative sexuality, we have to go back and think that, you know, the society is heteronormative. So that means that everything is based on the heterosexual perspective point of view. And that means that you need to have only one partner of the opposite sex. Usually it's preferable for them. Have children, being with them, staying with them for life, waiting, etc., etc. You know, everybody knows that. But is it why we should be like labeled? Sorry. Is it why we should be labeled? Because we're not having sex like the other, like the counterpart, the heterosexual person? Yeah, and yeah, this is what I wanted to say about that. And gays are hypersexualized too. Like if we take, for example, all the media coverage when we have the gay pride and the parties like Black and Blue, things like that, gays are hypersexualized a lot. I mean by that the media, what they're going to put on television is that, oh, gay are having a lot of sex. Oh, gay are getting HIV. Oh, gay are transmitting that. Oh, gay, they have the STIs. Gays, whatever. It's always gays, 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 gays. And I think it doesn't help us to, you know, to go through all of that and, you know, taking a to take back the power over our sexuality. So I was saying before that the prescription comes with a stigma. If I refer to Quebec, I don't know for British Columbia, but there in Quebec, for PrEP, for being prescribed, you need to not having a singular regular sexual partner, not using the condom systematically. So how many gay men do use the condom systematically? let's say you're sucking. How many, sorry if it's vulgar, but that's the word. Let's say you have a sexual encounter and you're doing a fellatio. How many people do you know that are going to put the condom on? Not knowing the serological status of sexual partners. You can only really know your own, and even then, there is a 3-month period. There is a lot of things that we cannot know for sure, except if you're abstinent or you're in monogamous couple. Are you using drugs with sex? Being in several different couple? Does your partner have a detectable viral load? Etc. etc. So the prescription at the base is really, really stigmatizing the people that are willing to get it. When we think about that, it reduces a lot the anxiety around PrEP, of having its own sexuality, you know? And who has never felt a bit anxious about having sex for the first time with somebody and not knowing his serological, status or... Yeah, so we try to meet the criteria of an heteronormative norm, but are we that? I don't think so. Whereas, I don't know, we have to create our own sexuality. I think it's the part that is, pleasant in our community, because we are allowed to start over, and the church don't say, oh, you need to do that and that and that. We write our own history all together. So I think here would be the place, the time to talk about all the experiences, because we're gonna talk.
Do you want to focus on you?
Yeah, and we can have a discussion, because basically after we're going to talk about end users and users of PrEP, and it's going to be what we're going to discuss.
Okay, great. Thanks, Maxime. So that kind of gives you a perspective of what's going on in Quebec. Obviously, a very different system than what we have here in British Columbia. I mean, it's not that different, as Nathaniel called me on. We do have pharmacare in British Columbia. Unfortunately, currently, pharmacare it's not on their formulary to cover PrEP, whereas it is in Quebec. Which means clinics like L'Actuel and Hypergay, and even if you just have the Quartier Latin, even if you just have a very knowledgeable doctor, it's much easier there to get on to get on the program. But still, because of the criteria, I would argue that Quebec's system, it does begin with that stigmatizing prescription, right? So we had a really interesting conversation with I'm not going to embarrass myself by pronouncing his last name, but his first name is Israel, and basically Israel runs the HIV program in San Francisco. And I had a really kind of heated conversation with him over a couple of glasses of wine, and we debated whether or not all gay men should have access to PrEP versus this targeted program. And different cities and different jurisdictions are taking different approaches. But if you think about it, they're both stigmatizing, whether or not it's like, oh, well, you're gay, so now you qualify for this, and so therefore you have to, come out and whatnot, or whether or not it's even more fine-tuned into that.